Understanding Diabetes and Testosterone Replacement Therapy, TRT. Welcome to our channel. Today, we're diving into an important and often misunderstood topic: Diabetes and Testosterone Replacement Therapy, or TRT. Throughout this video, we'll explore the relationship between diabetes and hormones, discuss what TRT involves, and examine whether it can play a role in managing diabetes effectively. So, let's jump right in. Understanding diabetes. Diabetes is a chronic condition characterized by elevated levels of blood sugar, glucose. This happens either because the body doesn't produce enough insulin, type 1 diabetes, or because the cells don't respond to insulin properly, type 2 diabetes. Insulin, a hormone produced by the pancreas, regulates blood sugar levels and facilitates the absorption of glucose into cells for energy. Therefore, the interplay between hormones and diabetes is fundamental to understanding the condition's management. What is testosterone replacement therapy, TRT? Testosterone replacement therapy, or TRT, is a medical treatment designed to supplement testosterone levels in individuals whose bodies do not produce enough naturally. Testosterone is a crucial hormone in men that contributes to muscle development, bone density, fat distribution, red blood cell production, and sexual function. Low testosterone levels, also known as hypogonadism, can occur due to aging, certain medical conditions, such as obesity or chronic illness, or treatments like chemotherapy that affect hormone production. TRT involves the administration of testosterone through injections, patches, gels, or other methods to restore testosterone levels to normal ranges. Can TRT help manage diabetes? The question of whether testosterone replacement therapy can aid in managing diabetes is a topic of ongoing research and medical debate. Some studies suggest a correlation between low testosterone levels and insulin resistance in men, a condition where cells fail to respond to insulin effectively, leading to elevated blood sugar levels. Insulin resistance is a key factor in the development and progression of type 2 diabetes. By improving insulin sensitivity and glucose metabolism, TRT may potentially contribute to better blood sugar control in men with diabetes. However, the relationship between testosterone levels and diabetes management is complex and varies from person to person. If you like this so far, please like and subscribe. Considerations and risks. As with any medical treatment, TRT comes with considerations and potential risks that need to be carefully evaluated by healthcare providers. Monitoring testosterone levels and adjusting TRT dosages are crucial to achieving optimal therapeutic outcomes while minimizing side effects. Risks associated with TRT include an increased risk of blood clots, prostate enlargement, acne, sleep apnea, and changes in mood or behavior. Additionally, long-term effects of TRT on cardiovascular health and prostate cancer risk are areas of ongoing research and concern. It's essential for individuals considering TRT to discuss these risks and benefits with their healthcare provider to make informed decisions about their treatment plan. Lifestyle factors. While testosterone replacement therapy may offer potential benefits in managing diabetes, it should be considered as part of a comprehensive approach that includes lifestyle modifications. Lifestyle factors such as maintaining a balanced diet, engaging in regular physical activity, managing stress levels, monitoring blood sugar levels closely, and adhering to prescribed medications are crucial in managing diabetes effectively. These lifestyle changes can complement TRT and contribute to overall health and well-being. Exploring research and case studies. Let's delve deeper into current research and case studies surrounding testosterone replacement therapy and its potential impact on diabetes management. Research studies have explored how TRT influences insulin sensitivity, blood sugar control, cardiovascular health, and quality of life in men with diabetes. Case studies provide insights into individual responses to TRT and highlight both successes and challenges encountered in integrating TRT into diabetes care plans. Understanding these findings can offer valuable insights for healthcare providers and individuals navigating treatment decisions. Don't forget to like and subscribe. Patient perspectives and testimonials. To provide a more personal perspective, let's hear from individuals who have undergone testosterone replacement therapy as part of their diabetes management. Their first-hand experiences, challenges, successes, and changes in quality of life will provide real-world insights into how TRT has impacted their overall health and well-being. Patient testimonials can offer encouragement and support to others considering TRT as a treatment option for managing diabetes. Expert interviews. We'll also have the opportunity to hear from healthcare professionals specializing in endocrinology, diabetes care, and men's health. These experts will share their knowledge and expertise on the relationship between hormones, diabetes, and the role of testosterone replacement therapy. Their insights into the latest research findings, treatment guidelines, and patient management strategies will help clarify common misconceptions and provide practical advice for healthcare providers and individuals alike. Conclusion and final thoughts. In conclusion, diabetes and testosterone replacement therapy are interconnected through hormone regulation, insulin sensitivity, and overall metabolic health. While TRT may hold promise as a potential adjunctive therapy for managing diabetes in men with low testosterone levels, its use should be carefully considered in the context of individual health needs, risks, and benefits. Collaborative decision-making between patients and healthcare providers is essential in developing personalized treatment plans that optimize diabetes management and overall well-being. Thank you for joining us on this journey through the complexities of diabetes and testosterone replacement therapy. If you found this video informative and insightful, please like and subscribe to our channel for more content on health-related topics. We value your feedback, so please share your thoughts and questions in the comments section below. Remember, your health is important, and making informed decisions with the guidance of healthcare professionals is key to achieving optimal outcomes. Until next time, take care and stay healthy.